What is up, everybody? My name is Han, and you are listening to the Arcanum podcast or watching the Arcanum YouTube channel. Today, we are going to talk about BPC-157, one of the most searched for and actually first compounds people in this space start using. Here's what it actually does and what we actually know. So here's what we're going to do. First, we're going to discuss what it actually is, the odd structure it has, and how it's able to survive in the human stomach. Then we're going to talk about how it works, the supply line mechanism, and we try and make it simple and easy to understand. Then we're going to talk about what we actually know, the evidence, and honestly, it is a lot, but it's also a lot of anecdotal evidence. Who's it for and what are the risks, including the big cancer question. How to use it, dosing, cycling, stacking, and what to track when you actually use it. So let's start with the first thing. What is it? BPC-157 is a fragment of a protein found in your stomach. It is a synthetic pentadecapeptide, meaning it has 15 amino acids and it has been found in human gastric juice. It's also one of the oldest peptides in the space. It was first discovered by a professor at the University of Zagreb. So it's actually built to survive this stomach. It has 3 consecutive prolines, and that actually means it has a pretty rigid structure and it's actually pretty resistant to the acid in our stomach, which allows oral usage as well. It's been proven to be stable for more than 24 hours in gastric acid. It does degrade a bit, but not as fast as other compounds. And its first patent was founded in 1992, and there has been 30 plus years of research since. So on to chapter 2. How does it actually work? We usually use it for tendon and gut issues, and these barely heal. In terms of tendons, no blood flow or little blood flow actually get to those tendons and ligaments. And the blood carries the oxygen, the nutrients, and repairs the cells that the rebuilding of a injury actually depends on. So that is, in terms of tendon and ligaments, the issue. The repair cells or the construction crew barely is able to get to the place they're going. When it comes to gut lining, the problem shifts a bit. The gut lining turns over so fast and it is hidden behind a thin and easily damaged layer, which can cause some issues and can prevent healing. Essentially, the building is being torn down while it's still in repairs, and you need to speed up reconstruction or fixing before you're able to get to a place where everything is actually stable and not inflamed. So again, the consequence, repairs stall. There's not so much a lag of signal, but there is a lack of supply. And this is where our hero, BPC-157, comes in. The rate limiting factor in some of the cases, these cases, is actually perfusion or blood flow to the actual tissue. So it doesn't directly rebuild tissue, it reopens or helps open up the supply lines so everything can get there. It amplifies the vascular endothelial growth factor signal, that is the VEGF signal, and that signals the body to grow more or grow better blood vessels. It also releases the nitric oxide brake, freeing eNOS through the SRC pathway to make more nitric oxide. And this in turn widens vessels and lifts blood flow, so improves blood flow. Your blood veins will actually open up, allowing for more nutrient and oxygen delivery. Then, cool side effect, or side effect, no, main effect actually. But when it comes to healing injuries, it is pretty nifty to have. It makes cells listen harder or better to actual growth hormone signaling. So it upregulates the GH receptor on those repair cells, mainly the fibroblasts. And when it comes to tissue repair, those fibroblasts are the ones that lay down new layers of collagen. So in terms of both gut lining and tendon healing, those are the signals you actually want. With the supply lines wide open, or at least more open or laid down where they weren't before, you allow for better oxygenation of tissue, so more oxygen delivery, and nutrients and repair cells can actually get to the destinations they're trying to get to, those tendons or those issues, and in turn allows for an increased rate of healing. So beyond blood vessels, it also nudges several repair systems at once. It modulates inflammation downwards, so TNF-alpha and interleukin-6 are signaling molecules that are present when an injury occurs. Those get toned down, and they turn down damage without actually switching off healing completely. Interleukin-6 and TNF-alpha don't directly damage tissue, but they, due to turning down the volume knob on these signaling hormones, you allow other cascades that are more beneficial to take over. It helps repair the gut barrier. There are more tight junction proteins, so ZO1 and occludin are the mortar sort of that slide in between the cracks of those junctions in your intestines and prevent leakage of proteins and other compounds into the bloodstream, which might cause immune issues. It's also been shown to protect nerve and brain tissue in injury models, so TBIs and other things. This is a bit beyond the scope of this video, so stay tuned for a specific video on TBI treatment and nerve issues where we will use BPC-157 as well. It also counteracts some of the corticosteroids impaired healing, so NSAIDs, ibuprofen, stuff like that can have negative effects in terms of healing because you actually need some of those inflammatory cascades to improve or speed up tissue healing. Cortisone stalls tendon repairs. This kind of pushes back, so BPC-157 pushes back the negative side effects of those NSAIDs to help further improve tissue healing. There are also some things it doesn't do. It doesn't influence just one single receptor. It nudges several repair systems all at once, almost like a general contractor if you look at it in a construction scenario. It's not androgenic, so it doesn't influence the sex hormones. It doesn't influence estrogen or testosterone, though through healing pathways, you might end up healthier with, in turn, more optimal sex hormones, which is always a good thing. It does not directly switch off inflammation. That effect is pretty much secondary. So by improving the overall blood flow, delivery of oxygen and nutrients, it allows the body's own signals to tone down pretty quickly and to get that alarm phase 1 down to a 2 or 3 or 4 and just like dampen everything down a bit. There's not one clean target. Its strength and its weakness. It is broad in its effects. It does everything. It doesn't do one specific thing. It doesn't target one specific tissue. It goes systemic no matter how you take it. And that also makes it kind of hard to study in turn. Let's quickly look at how it differs from TB500 and KPV. So BPC-157 rebuilds the blood supply through VEGF and nitric oxide signaling. It upregulates GH receptor on fibroblasts and specifically its sensitivity to those. It survives the stomach because of those actin bonds, and it can work orally as well. Not so much in terms of systemic effects, but local effects nonetheless. And its anti-inflammatory effects, like I said, are secondary. It's not a primary mechanism. TB500 and KPV, however, move repair cells in terms of TB500, and it remodels tissue. And KPV blocks that NF-kappa B, which kills the inflammatory response directly. So if you have chronic inflammation, there's no use for that inflammation at that point, and it's hindering your recovery. That's when you can add in, for example, a KPV to this stack. Neither of those two, so talking about TB500 and KPV, rebuild the actual supply lines. Now you can see how those three compounds can work synergistically in a stack. And that is also why they're stacked and not swapped out. So perfusion is the real rate limiting step, and by reopening the supply lines, and repairs will follow after. And hold on to that sentence, because who it helps, how it's stacked, and why the cancer question exists at all is a consequence of this statement. So what do we actually know? Well, decades of animal data, a mountain of real-world experience, and still no large human trials, sadly. Practitioner, coaches, and biohackers report strong results, however. So how strong in this case is the claim by claim? And this is a confidence read. Take from this what you will. It's my way of putting things into perspective. These are hard numbers, and if you ask another practitioner, they will probably give different answers. In terms of tendon and soft tissue healing, 78 might as well be 80%. There is a lot of study and a lot of results on this. Gut repair and protection, likewise, a lot of evidence, both anecdotal and in rat models. And angiogenesis, which is the building of new blood vessels, and nitric oxide mechanism is well described both in animal models and in vitro, as well as in anecdotal evidence by coaches and clients, all the same. There is still a real gap. There is a big anecdotal base, but there are very few to none controlled trials, which is sad, but to be expected within the space. So, who's it for, and what are the risks? Well, here are the people who it might actually help and who should probably steer clear of BPC-157. In case you have stubborn tendon and ligament injuries or issues, the classic perfusion problem, BPC-157 will be, BPC-157, not TBC-157. BPC-157 will be one of your main healing or agents to help in healing those injuries. If you have gut issues in the form of IBS, IBD, oral or just ulcers in general, adding BPC-157 will improve blood flow to those tissues, allowing you an increased rate in recovery and reconstruction of that gut lining, which will in turn prevent leaking of proteins and other things into your blood supply and down-regulating immune function. Post-surgical or chronic soft tissue recovery, if you need surgery for some reason, the common practice is to wait 1 or 2 days for the natural inflammation response to die down a bit before adding BPC-157 and, among other things, to speed up recovery. And me and a lot of other practitioners have used this exact molecule in its place in like a stack to help post-op recovery. Those running GH peptides or GH in itself who want to amplify the ability to send repair signals for soft tissue. Who should stay clear? Well, if you're pregnant or breastfeeding, well, probably best to steer clear, as there is no evidence or trials in that space. If you're on blood thinners, there might be some interactions and you might require some extra oversight. In some people, it aids in terms of clotting. In some people, it extends clotting time. So be sure to reach out to your practitioner to ask and or make a plan together if you decide to add BPC-157 to your stack. If you're drug tested, if you're a drug tested athlete, it has been WADA banned since 2022, I believe. So definitely don't use it because you will you'll get flagged, and we don't want that. If you have active or prior cancer, well, angiogenesis, and we'll talk about this later, cuts both ways. And best thing is to actually see an oncologist before deciding to start this compound. Then for the big cancer question, something that grows blood vessels, could it also feed a tumor? Well, I've read the research, and these were mostly mouse and rat models, and it seems to be an honest consequence of the mechanism. And the interesting thing is that the animal data cuts both ways, so it shows it would improve blood flow to a cancer or a tumor, but it could also cut off blood supply, and that differs per cancer type probably. And to be completely transparent and honest, I and several others that I know do not have experience running BPC-157 in active cancer scenarios. So in this case, I would conclude, along with some of my fellows, that a cancer history is a hard stop, as in do not use unless you are cleared by somebody that is actually medically trained to give his or her opinion on the matter. In this case, an oncologist. Safety profile wise, animal toxicology shows really reassuring numbers. So no adverse effects were seen at even absurdly high dosages. Common side effects are reported as injection site redness. That might be due to the place where you source your BPC-157 from. A higher mannitol content might result in some local skin irritation, which will disappear after either a few hours or after a day or two. If you are also using benzyl alcohol containing water, so bacteriostatic water, to reconstruct your peptides, that might also cause some slight irritation, especially when the concentration of benzyl alcohol is pretty high. Some users report occasional headache or lightheadedness. This has to do with the nitric oxide signaling, increasing the blood vessel diameter, also in your brain, which can cause some headache issues and might actually cause a drop in blood pressure. So if you're on blood pressure medications, make sure to double check and actually measure. Some people report changes in mood, mostly positive. It interacts somewhat with the dopamine pathways and other neurotransmitters. So people report actually feeling a lot happier when using BPC-157. There are also one or two cases that I know of people who felt almost inhedonic, meaning they cannot derive pleasure from anything. Luckily, after ceasing the compound usage, this went away in like a week or two at max. So better safe than sorry, and good to keep an eye on. It seems to protect the gut against NSAID and alcohol-induced issues. However, this is not a clear license to abuse either. If you can steer clear of both, that's even better. And there is still, like I said before, no long-term human data in terms of safety. None. We only have anecdotal evidence for now. So let's get on to the juicy part, how to actually use it. Same peptide, and we can have several routes. You can take it orally, in which case you are at a 500 microgram-ish dose, taking twice daily on an empty stomach. And this is best used in case of gut issues or ulcers. You can go the subcutaneous route, the most used route in terms of peptide usage in the space. And you would dose that, depending on your problem, from 250 micrograms up to 1 milligram per day, either subcutaneously near the injury site or in the abdomen for systemic effects. There is, nowadays, there are also a few topical creams available. Those who are either needle averse or in case you need to put it somewhere awkward, this is where you can use a cream. However, this also bleeds over to some systemic effects, and I would caveat this with never put BPC-157 cream in an open wound, because that will result in infection. So don't go there. Reconstitution is actually pretty simple. If you have a 5 milligram vials and you add 2 milliliters of bacteriostatic water to that, you will get a 250 microgram per 10 IUs on an insulin syringe, which will make dosing pretty easy. If you have a 10 milligram vial, you can add 2 milliliters of bacteriostatic water, which will net a 500 microgram dose per 10 IUs on an insulin syringe. So dose accordingly and use the plethora of online available calculators if you're in doubt. And here are some of the ranges reported in practice. Again, this is a reference, this is not a protocol. As a background player, for example, if you are a weekend warrior and you need some extra added soft tissue recovery, you could go for a daily dose of 200 to 250 micrograms, and this will lead to some general support, gut maintenance, and background recovery ability. If you have a basic healing protocol in place, that means the BPC-157 will probably be part of a stack, in which case it will be dosed either at 250 to 500 micrograms per day. And this is for your active injury repair and is part of most stacking protocols. If you need active, like acute repair, for example, after surgery, or if there is really a blood flow issue, you could go up to 1 milligram per day. And this is also used in significant chronic dysfunction scenarios and some gut issues. And like I mentioned before, also some post-surgical recovery. How fast does it actually work? Well, if you start using it, remember, connective tissue rebuilds slowly. So the important thing is to be patient. The gut, using the oral route, you can observe most positive changes after 1 to 2 weeks, but fuller effects take place after 4 to 8 weeks. So be patient. Tendons and ligaments have blood flow issues, so it's best to not judge anything before the 4 to 8 week mark. Post-surgical, 4 to 6 weeks at minimum, and you can keep on using it until you're 95 to 100% healed. Usually a post-op check is also done by either the surgeon or a doctor you visited at your hospital or clinic before. My experience with my clients and personally when using BPC-157 as part of a post-surgery recovery stack is that they are blown away by the way your body is healing, especially if you have the basics in place, meaning sleep, nutrition, and exercise where possible. Again, these are not signs, or these are signs, not endpoints. So less pain, more low tolerance, fewer flares. Those are all things you can actually observe. There is no hard, I am now recovered standpoint in some of these issues. So keep that in mind. In terms of cycling, it is recommended to actually cycle as effects tend to plateau in terms of blood flow after 8 to 12 weeks. And this has to do with some of the rate limiting factors. You cannot grow new blood vessels indefinitely, luckily, or you can, but you cannot with chronic signaling. Hence, we cycle our peptides. Standard protocol would be 4 to 8 weeks on, then followed by 2 to 4 weeks off. This is the common pattern. In case of an acute injury, you can go for a single 4 to 6 week block, or you can continue that block until your injury is actually recovered. Chronic usage, I recommend going up to 3 months or 12 weeks of chronic use before a 1 to 2 week break, just to help reset things. You could theoretically continue using this until you are fully healed, but keep in mind that we do not want chronic signaling always. Maintenance dose, This can be thrown in as part of your rotation or longevity stack at 200 to 250 micrograms per day for a period of blocks, meaning 4 to 8 weeks, and do that 2 to 3 times a year. Again, this is educational only. In terms of effects, what sticks, what doesn't, and what fades, things that persist. If you use BPC as part of a stack to actually heal an injury, it's not like you're going to stop using BPC and the injury reoccurs instantly, depending on what you do on the court or however you got that injury. But normally a healed tendon actually stays healed, meaning the actual repair took place. Things that fade, an active protection, so that gut buffering, that extra blood flow that might hinder or help you recover quickly, that kind of fades. So any new injuries will be dependent on the quote-unquote old blood flow restrictions once you've stopped using. And the ongoing background effects in terms of dopamine signaling and stuff will also fade slowly over time. Order matters. Calm it down and then rebuild it when you start using this peptide. If the tissue is still angry, as in hard, inflamed, calm it down first. This is also why we wait before introducing different peptides after a surgical event. KPV can be used to block that inflammation in an acute sense and help that repair stick. If your injury site is inflamed, continuously inflamed, we need to get that under control first. Keep an eye out on infection as well, because if a tissue is actually infected, toning down that inflammation may actually cause that infection to get worse. Again, inflammation has its function. There is the Wolverine stack, which combines BPC-157, so that allows the increased blood flow and actual tissue remodeling effects of that TB500 to work synergistically, and one helps the other work better as well. If you add GH or GH peptides to that as well, you get an even further increased rate of healing and building tissues. It increases the growth hormone receptor sensitivity, so that pulse in case of CJC 1295 or ipamorelin actually hits a lot harder in terms of actual effects. However, foundations need to be put on first, meaning sleep, adequate sleep and recovery, protein intake. You actually need building blocks to repair your tendons and your ligaments, and training where possible. This also increases heart rate, increases blood flow, increases oxygen supply. Your aerobic conditioning also does a ton for injury recovery. So if those three aren't in place, you can take all the peptides in the world, but you will not recover as fast as somebody who has these basics in place and adds on BPC-157. Things to monitor, and again, this is N=1. This might be different for each and every one of you, but these are the things I tend to monitor with my clients and with myself. Pain and morning stiffness in case of an injury. This is the earliest signal, and this is something you can measure daily. You can rate it 1 to 10, 10 being the worst, 1 being the best. Low tolerance, and this is a function, and you can, if you are cleared by your physiotherapist, your doctor, or your coach to start training again, this is something you can measure again every training session. High sensitive CRP, which is a very clear sign of inflammation that can be determined through a blood draw. Again, this is not for everybody, but using BPC-157 and increasing that blood flow should also help bring down those inflammatory cytokines pretty quickly, meaning a drop in HRCRP after as soon as 6 to 8 weeks compared to baseline. Blood pressure. This is something to keep an eye on if you are on active blood pressure medication. When first introducing BPC-157, I would recommend daily blood pressure monitoring, and you can use either a automatic arm or a wrist monitor and contact your caregiver or doctor in case of blood pressure drops. After that, once everything is stable, you can go on or go back to a weekly monitoring. And then liver enzymes, in case of NSAID or alcohol toxicity, this is something you can definitely monitor, and you would take a baseline draw, get the numbers from that, start using or introducing those peptides as part of a stack or solo, and then re-measure after, let's say, 6 to 8 weeks or maybe 12 weeks even. Troubleshooting. I've taken BPC-157 and I feel absolutely nothing. Well, it's either too early. Tendons need like 4 to 8 weeks before you can actually start judging that. Like, it will start working from the first end, but it's not specifically a peptide you will feel all that much. Maybe the dose is too low. Some people sit way under the reported range, either due to finances or due to underdosed products. So make sure that the product you are using is actually legit and that the dose you are using is actually effective. Maybe you're using the wrong tool. If inflammation is the rate limiter, you might need KPV and you might not need more BPC. The blood flow might be perfect, but if that inflammation sticks around, well, you can get all the blood flow you want, but the repair crew won't be able to do their job. There's no use in building or rebuilding a house if it's still on fire. Sourcing reconstitution, bad products, bad maths. Make sure that the products you source, wherever you source them from, are actually legit. Get them tested. There are plenty of groups out there that do batch testing as well, and you should be able to get your hands on a good quality product pretty easily. And also make sure that the actual reconstitution math checks out. Again, online, there are plenty of calculators, and we might even host one ourselves sometime in the future. If there is a actual mechanical problem, if there is a full disconnection of a ligament or tendon, you might actually need surgery. You might not need peptides. A full tear will never heal on its own. Well, where does this leave us? Well, this leaves us in a place where there is still no human trial. 1992, the first patent at the University of Zagreb was placed, and there is 30 plus years of actual animal work in terms of tendon, gut, brain, vessels, all kinds of stuff, mostly actually from one research group. There was a phase 1 and phase 2 trial. It was run, then it was never published. There were Croatian trials on the inflammatory bowel disease, and sadly only the conference abstracts were published. If you have access, or if you know somebody who has access to these actual papers, then please let us know, because we are dying for the results. There was also a 2015 oral trial, but that got cancelled and withdrawn, and the results were never published, sadly. Then in 2022, 2023, the doors closed. WADA bans it, and the FDA places it in category 2, meaning it is off limits as of now for compounding pharmacies. Though with the current political climate in the USA, that might change for the better. Most importantly, read the evidence yourself. This is the research I based this presentation or program or podcast on. You can screenshot these. These are all public studies that are pretty easily found through PubMed or Google Scholar. Read them yourself, read the underlying mechanisms, and make informed decisions. Conclusion, the mechanism of BPC-157 is very real and very applicable. It reopens the supply line so repairs can actually happen, because blood, oxygen, nutrients, and that construction crew actually get to the injury site. It's still considered very much experimental by healthcare, but it is very common practice in the longevity and biohacking space for good reason. It works. Foundations first. Again, no peptide out-heals a bad sleep, food, or training habit. It's a tool. It's definitely not a cure-all. Stay tuned for the next video, because that was all for this session. Next on file will be TB500 and the famous Wolverine stack, how that synergistically works, and a lot more cool stuff to come. Make sure to subscribe to the channel, to the podcast. Check out the website www.arcanum.health, and make sure to subscribe to the newsletter where I try and post something interesting every week from the space. And this also contains a lot of information in terms of sourcing and other things that I'm unable to put here. In case one of our videos gets taken down, or maybe even the whole channel, make sure you are subscribed to stay in the loop. Again, this was Han. This is the Arcanum podcast and YouTube channel. I hope you have an amazing rest of your day. Thank you so much for all your attention and all the positive comments you've left me so far. And I will see you in the next one. Bye.